This is a message from Anonymous.
Do you believe oxygen, hospital beds, medicine supplies, etc. shortage was it real? Do you think life is more valuable than data? Do you feel digital solutions are secure enough? Do you smell data beyond duties? Patients with COVID passed away due to lack of supplies like oxygen, remdesivir, and various other essentials. Patients with COVID could not find empty hospital beds. There are long queues outside hospitals of ambulance containing patients. Black marketing of essentials happened at full scale. And still, we were only interested in making vaccination records, but not in saving lives. For items which were essential and were black marketed, KYC or mobile verification was not enforced. Whereas vaccine, which had production in abundance and voluntary, KYC or mobile registrations was made mandate. Bed availability not shown online, but see the parody. You can book movie tickets online with option to select corner seat also. This is a sample COVID vaccine certificate. There had been items to be kept secret. Example, ID proof number, UHID, date of birth, etc. Here, mask ID was optional feature. Aadhaar number was masked, but if you use any other ID, those were not. Example, if you use driving license, it is disclosed without masking. Now having this driving license, anyone can raise traffic violation on some innocent victim's name very easily. Similar way, UHID, which was generated based on Aadhaar number, was also disclosed. Government is yet to decide its usage. Once it is started to be used at full potential, that would be really crucial, even more important than driving license probably. Vaccination certificates, secure QRs used to leak information to the verifier. While making vaccination certificate, idea was to keep sensitive PII PHI secret by not sharing even with an authorized verifier. However, QR code contained all such sensitive PHI PII data. Upon scanning QR, client libraries used to read all the sensitive data and send it to the server from verifier's device. Hence, any authorized verifier who wants to steal this information, or it takes his browser's network console, or setting up a proxy in self-device, or doing runtime data analysis. Now let's talk about data authenticity and integrity. COVID vaccination certificates verification system did not work as revocation list wasn't maintained at all. Self-enroll corrections also were allowed. Even bigger risk is all vaccination certificates, probably 2.6 billion certificates, seems they were planned to be signed with a single private key. Looking at the dreadful history of PKI or CA certs, no one should repeat this mistake. Past says breach can occur with strongest vault or within finest secured configuration systems as well. UHID, unique health identifier, a 14-digit unique number, identifies person's health records. Map based on Aadhaar number or combination of mobile number with date of birth of a person. Planned to be used to track and monitor health records by public healthcare sector or government. Allowing user to grant or deny access to health records as per their desire. Forcibly, without consent, enroll the users who took vaccination with their Aadhaar card. Person can create multiple UHID and delete anytime. PII, PHI data to be stored with healthcare information provider and used as per their privacy policies. So public again lost control of how their data is going to be used. Now let's see fundamental loopholes. Millions of people surrender their life against COVID-19. Still, no nation, regulatories, global health organizations, pharma companies made medication license open. In name of IP, they just were focused on making capital but no humanity. Majority of industries today run behind job work or brand licensing or subcontracts with third-party vendors. Then why not medicines to save lives? If you opt for vaccination, the process will force you to share OTP. Despite campaign everywhere, never share OTP with anyone. Hospital facilities will ask you the OTP and only after that they will vaccinate you. If this continues, how would you stop people from sharing OTP to prevent from phishing? No ambulance or crematoriums, but we enjoy booking rides to restaurants via app. Inaccurate COVID-19 cases counts where home quarantines are not considered. Testing slowed and still compared with days when testing was done rigorously. On top we measure concept of wave. Getting vaccinated is just like wearing helmet for self-protection. Even if someone is vaccinated, study shows they still can transmit virus. In current era of every smallest thing mobile enrollment is enforced, how come RT-PCR reports without OTP verifications were allowed? People entered incorrect mobile numbers so they can roam around freely when tested positive. Negative RT-PCR report copies were sold whoever wants to buy without test. Covidiots used forged RT-PCR reports and were active spreaders, but our technology was sleeping. Where did these solutions and private companies go that time? Both Android and iOS can be used to create fake GPS location without need of rooting or jailbreaking the device. Would location of contact tracing apps be counted accurate in that case? No data is in fact better than the skewed data. So moral of the story is human life value is inversely proportional to the population and human data is directly proportional to the population. A very simple equation, value of human life is now much less than the data. Possible mitigations: having a backbone infra to validate documents across all domains and sectors. Account essential items via digitizing them and have watch on its usage to eliminate abuses or hoarding. Don't try to fit technologies everywhere, especially when it's of no use or impractical. In future for digital credentials, pay close attention on integrity. Remember, human brain can cheat everywhere. When it comes to securing data confidentiality, delay in launch is acceptable, but please threat model all abuse cases and invite elite security folks to review it well. Humble request to folks into information security industry, please support and speak up to bring awareness.
We are anonymous. We are legion. Expect us.